Meow! Huples' cat. Becky's over here, I'll show her in a minute. One of the complaints that I get, and it's a valid complaint, is that, well, what do you do if you don't have access to personal protective equipment? PPE is the lingo for that. And there's a pandemic. What do you do if you have no N95 masks? What do you do if you don't have any surgical gloves? What do you do if you don't have any disposable gowns? What do you do if you don't have any disposable goggles? It's a valid question. I would point out, again, that if you're watching my channel for more than a year, you would have that stuff in place right now. But will it last? People who haven't been watching my channel probably have a whole bunch of ammunition and guns. Probably 3 or 4 N95 masks. They're probably thinking now, I wish I'd bought some more masks. The most important thing is the mouth and nose, but I'll get into that in a bit. First off, it's gowns. Stuff like this. If you're going to walk through a heavily occupied area of people, they're going to cough and put droplets onto your outer clothing in a pandemic. They do that all the time now. Most of it's fine. But there is a potential in a pandemic, if it's highly infectious, to actually then touch your clothing and then touch your mouth or your nose or in fact your eyes. So one of the things, if you don't have hospital gowns, and hospital gowns aren't that effective except for physical touch contact with patients, one of the things you might want to think about getting is some disposable paper painter's gear. So you can just put this on and literally throw this out when you get back home, taking it off slowly, carefully, methodically. Now how do you do that? Well, there's lots of training online and you should look at it, but I'll tell you how I teach my students who are nurses to actually protect themselves. When you're in contact with people who are infected or might be infected, imagine that they're covered in sticky red jelly, all over them, sticky red jam if you like, and that everything they've touched has a layer of sticky red jelly on it. Your job is to make sure that none of that sticky red jelly goes anywhere except on gloves, and then when you remove the gloves, it's disposed of. If you get any of the red jelly on your chest or your upper legs, it's got a barrier there and you remove it. Think of that. Everybody's covered in sticky red jelly. Okay? Now if it's airborne or droplet, they're also snotting out sticky red jelly, which is where masks and goggles come into play. Not really a thing for me in January, but in July it would be. You need to dress appropriately for the air temperature. So if it's actually boiling hot and you want to go outside, you might want to go outside wearing gear that's suitable for the weather conditions. Solid plastic rain mats and boots and all the rest of it that people are recommending, having watched Ebola coverage, and Ebola is entirely different from Wuhan flu, isn't actually going to help you very much if you are sweating like a dog. Dogs don't sweat, you've got to love human sayings. And how's that going to protect you? Well, you know, you want this barrier there, you want a barrier there, that's what people are going to say, and it's true to some regard that you do want a barrier, but you want a barrier you can work and function inside. Okay, Huples, I don't have any painter's gear, and now because of your idiotic video they've all sold out online. Quite a few things have sold out, which we'll get to when we're talking about the face. So what do? Well, you should be a prepper, right? What's the one thing preppers should have an awful lot of that are dirt cheap? One thing. Think about it. Something that's waterproof, resistant, and cheap and disposable that you can use as an outer garment. Trash bag. You've got to be flexible. In Wuhan right now, the nurses and doctors are going through garbage bins looking for masks. Now, hair today, gone tomorrow. Try and keep it short, but don't go to the barbers this week or next. So if you are worried about the length of your hair, tie it up in a bun if you have enough. Man buns are in, if you have any hair here, that is, of course. And you can also put a little cap on it, and you see none of them. But again, a little toque works just fine, but have enough of them, take it off gently from the inside, not the outside, inside and outside. And again, you can wash that like you're washing your gloves. Now, face masks are a fun one. This is going to shock you. This is currently out of stock. I advise you to get this as soon as it is in stock. This is a 10-tree flick, and I'll put the links up for this. It's a bandana. If you double this bandana and take your time putting it on, they claim it's as effective as an N100 or an N95 for smoke inhalation. Certainly, it's not sealed tight. You'd have to fiddle around with this. So I put this on as the underlayer or any strong bandana that's cotton, and then I would grab this off the Bull Terrier, and again this stuff goes on slowly and with purpose. See what I'm doing here? Sealing at the top and the bottom. Yeah, it's uncomfortable. If I have to be in a room with somebody that might be infectious, airborne or droplet, I want this. When I take it off, I get rid of my gloves and wash my hands. Then I gently and slowly take this and take it off and practice with it. Because the more you practice with it, the less contamination you're going to do to yourself. Gently into the bin for stuff I'm going to wash. Not going to be comfortable. So, eyes. These are probably good enough. I will have to wash them carefully, not touching the outside of the lens or the inside of the lens. If I'm concerned about airborne viruses, I'm going to use swim goggles. They're far cheaper and more available. I have them somewhere. I can't find them because we painted this week. We're going to put the house back together next week, so hopefully I won't need them until I find them. There are of course the thick plastic goggles that you can use. They have holes in them, not fully sealed, but they're far superior. If the airborne virus is floating around, not on water, it's just floating in the air, probably you shouldn't go out at all. She's living in a bubble. But it's most likely to be transmitted on droplets, partially or fully. And the droplets are going to have a hard time figuring out how to get in there. The risk is the same with gas masks. When you take them off, you have this band, right? You don't want the band snapping in front of you. When you take off PPE, take it off slowly and don't breathe or talk just before you take it off until after you've contained it for a reasonable amount of time. You don't want to pass out. Now in SARS, our dogs were kept in quarantine with us and we kept them away from friends and neighbours. Doggies and catties are not going to catch this, but you're breathing and touching them. So don't be going up to dogs and cats and petting them, thinking that because the owner's staying 2 meters away you're okay. And that's the other thing. The guidance is official, 2 meters is safe distance. Research suggests that 6 meters, which is about 7 yards, is actually the safe distance for somebody that's projectile sneezing. You pay your money, you take your choice. You'll also see that you have to spend 15 minutes or more in close proximity with somebody before you catch it. Nobody knows. I would err on the side of 1 second I want to be protected. The bus drivers in England who had zero protection whatsoever because they weren't deemed to be close enough to the people from Wuhan that had been evacuated, well, I hope they were right. Personally, there's no way I'm going to walk into a room without protection. However, if this is Spanish flu, and it may or may not be, it seems to be weakening, which is the good news, that I may well run out of personal protective equipment at work. Now in my case that's highly unlikely because much like the politicians in China, I get first dibs on stuff. Lucky me, right? But if you are in that position, you want to ration your equipment, but you don't want to reuse the equipment unless you absolutely have to. Reuse definitively caused SARS death in Toronto, one for definite in the nurse, because we were reusing the yellow gown that hospitals use. They were told, just reuse it for the same patient, it's okay. And that's fairly good practice, depending on what the issue is. Of course, for a droplet-borne virus like SARS, that was like the worst advice they could give them. A lot of them got SARS and one of them died. So try not to reuse stuff. Try to make stuff work. If you're going to reuse it after it's been cleaned. There's no reason at all why most viruses won't survive 2 high washings that's not crushed in a modern washing machine, and then a high dry, especially if you then use sunlight for at least 12 hours to actually touch all of it. So that's my advice. I don't think you should panic. People are telling people to wear Wellington boots, rubber boots. I'm not altogether convinced that's a good idea. I'm not altogether convinced that's practical. For sure, if you are in a quarantine area, you want to have outdoor shoes and indoor shoes. That's pretty straightforward, it's pretty basic. Think about it. Think about that red jelly, that red jam. If it's on your soles of your feet, you don't want to necessarily take those soles of the feet and bring it into the house. So take sane and sensible precautions. There are people online saying that you should take bleach baths. Absolutely not. You can't sterilize yourself. It's harmful to the human health. So I'm interested to see what Frederick of the Paired Norseman's found out about actual bleach sterilization of gear like this. I think it's reasonable to continue to use bleach sterilization at high concentrations until we know it's not safe if you're in a very high pandemic infected area. If you're not, obviously you're overkilling, and that's always better to do too much than too little, and that's always true until you actually harm yourself by that. So I think at the moment my advice would be do not use strong bleach solutions unless you're in a high pandemic area, and I will look into it. If Frederick can't do a video in the near future, I'll actually go to PubMed and try and find the research he's basing it on. I think that's an important thing. So I hope people are happy. My dogs are happy. Mr. Bear has recovered physically from his toenail. He has not recovered mentally. We did try to walk him today, but he's decided that he's now a crippled bull terrier. This will probably last a few weeks, and then he'll be back to his normal, crazy self. So I'm at home, waiting for the painters to come back tomorrow. I have absolutely no conviction that they'll finish tomorrow, so this will go on. But tonight, both me and Kitty are going to work at the Sunnybrook Hospital. As far as I can tell, there are no new cases at our place. I'll find out when I go in. I'm going to link and talk about downstairs an Ontario Health Government site that is, quote, only for healthcare providers. There is a public site. Anyway, they can go and get stuff. I don't see any reason at all why anything that is for me or for you shouldn't be for both of us. So I'm going to put it there. You'll find it of limited use, but you'll find it interesting. I do want to talk about the overly cautious decision making that's still going on in February about this case, this flu case. We are still not looking for anybody who has not been directly or indirectly associated with one province in China yet. It's a Bad Terrier 2020 production.